PICO is one of the main methods used in formulating answerable foreground questions in clinical practice. PICO, of course, is the acronym, which stands for Patient or Population of Interest, Intervention or Issue of Interest, Comparison Intervention if there is one, and the outcome you are seeking or expecting. Note that time may be included in the PICO acronym, but it is only used as part of a question that is looking at the effect of a specific intervention of a certain duration or frequency. Here is an example of a clinical scenario where you could use PICO to help formulate an answerable question to start your search for evidence. Look for the PICO elements. Read this clinical scenario and see if you can pick them out. For this scenario, the patient or population would be geriatric patients taking multiple prescriptions. The intervention would be some kind of patient education. The comparison is tricky here, and there's not always a comparison. But we could say that the comparison is a different kind of educational intervention. So we could compare two types, or the comparison could state that there is no patient intervention as a comparison group. The outcome would be increased medication compliance. For this scenario, there are at least two possible approaches to the PICO components then. One would look at an educational intervention as compared to no intervention, and two could look at a specific intervention, such as nurse-led patient education classes, as compared to another type of intervention, perhaps one that is already being used, such as a patient medication information handout. The next step is to put the PICO components together in the form of a question. PICO question templates, such as this one, can help you with this step. There are more PICO question templates available, and a selection of templates are included in the PDF handout with this tutorial. The PICO elements we have identified with our scenario in a completed template could look like this, or like this, and put together into a question would look like this. Once you have identified the PICO components for your clinical question, you can use these to begin your search for the evidence that will answer your question. Your PICO question components are also the aspects you will be searching on when you turn to library databases. You can use these elements to plan out your search. Here is an example of what that might look like in the CINAHL database. Note that each PICO aspect is in a separate line, separated by AND to search for these aspects all together. Remember, the wording that you use in your PICO question is not the same as the language of the database. A no result search is often just a reminder to check out the database subject terms and then add these back into the searches you are conducting. It is always important that you check out and use the specific subject words used for your topic in the database you are searching. Note that you can combine different related terms with OR to search for either term, and also note that databases like CINAHL are set up for using limiters for age and gender, and this is generally much more effective than using words for your population searches. Starting with PICO to identify your aspects, then using the database subject headings for your search terms is an excellent start for searching for evidence on your clinical questions.